second wave is something we talk of ad nauseum. Is it something that you're really palpably concerned about?
You have to be concerned about it from the health and safety of the workforce. I mean, so the actions that we took at the beginning of the pandemic were to keep people safe, because whatever business you're in, it all relies on people to keep rolling. And so we have about 36,500 employees. Right through the pandemic, we had 14,000 that reported into work every day. And we work in an environment where we're used to PPE, we're used to operating discipline, safe behaviors and practices. It's the nature of the kind of work that we do in manufacturing. And so we moved into that space and we said, here are the things that we need to do. And it's worked remarkably well. I worry on a second wave, what I worry about is that the general population, if they don't follow the playbook, wear a face covering. It seemed to have gotten very controversial here about wearing a face covering, but it's a very simple concept. If you cover your face, your nose, and your mouth, you're protecting somebody else from anything that you aerosolize in the environment. And likewise, if they do that, they're protecting you from them. That's what doctors and nurses do when you go in to see them. It's a very common practice. And one of the things we know scientifically is one of the receptors that is the biggest for the disease is your nose. So if you keep your nose and mouth covered, you're mitigating your risk. And you're not completely eliminating the risk. I mean, the virus is still there. You can still get it. But we're trying to mitigate the risk. And I think if the public, gets itself too lax and they think, well, heat and sunlight is going to kill it. And then they say, I don't need to wear this mask, or I don't need to social distance, or I don't need to do these other things like wash my hands or sanitize. Then suddenly you see the cases go back up. And so the virus hasn't gone away, but we've reopened the economies. And as we go back in, if we don't have some discipline, we're going to see cases rise. And when cases start to rise, a few weeks later, deaths start to rise. So that's the concern. My concern is, keeping people healthy to keep things operational. I think the bigger concern is you don't want to see economies shut down again, because we saw that impact in April, May, and that was tough. And once you get it going again, you'd like to keep it going. So, what we try to implore everybody at work to do is follow these practices, not just at home, but follow at work, but follow them at home too. It's your best way to stay safe. And by the way, it protects everybody else.
And has that been a different message from country to country, employee to employee? We talked before about how you keep one culture at Dow, where you can walk into a plant that you might have based in Asia and it'll feel in some way similar to the one that you have in the United States. How have you managed that with so many people working from home, but also so many different geographical and global perspectives on the reaction to this pandemic?
Well, I like to think that because we're a science and technology company, that we take that view of it. So I do think within the Dow facilities, you'll see common practices. I would say culturally, we see differences. So in Asia, because they've had the experiences of SARS and MERS and other pandemic diseases before, there's a natural tendency that when something like this happens, they'll put on a face covering. And so there hasn't been an issue culturally with getting people to, adapt to that. Now, in some places, there's been a lack of somebody saying this is the right thing to do, or there's been mixed messages. And I think what that's led to is we're starting to see cases spike back up. And then when they spike back up, everybody says, well, we've got to go to face coverings now. I'll just give you an anecdotal data point. We haven't had a case in Asia Pacific. We've had them in Europe, and we've had them here, and we've had them in Latin America, but we haven't had a case in Asia.
Wow.
I think you've got to say there's a little bit cultural there that has an impact. And I know we're a small population of the world, but we're kind of a microcosm of society. So I think that says a lot.